Assalamualaikum students. My name is Dr. Sadia from Physiology Department FRTMC. Today we are going to study the triple skin response. So the material which are required for this practical are pin or needle, alcohol swab and cotton. Theory. Scratching the skin produces a characteristic series of reaction in the skin. When the skin is stroked firmly with pointed instrument, reaction on the stroke line occurs. The mechanical stimulus initiates contraction of the precapillary sphincters. The reaction is white line, which is due to the displacement of blood from the skin capillaries. The response appears in about 15 seconds, and this white line soon disappears, followed by three reactions: red line, wheal and flare. The red reaction appears at the site of the stimulus within 10 seconds due to the capillary dilation secondary to the release of chemical mediators, particularly histamine. This is followed by local swelling, edema around the injury within few minutes due to increased permeability of the capillaries and the post-capillary venules with extravasation of fluid. The redness spreading out from the injury, that is flare, is due to the arteriolar dilation. This three response, that is red, wheal and flare reaction, is called triple response. Now come to the axon reflex, which is very important for the triple response to occur. Axon reflex is an automatic response in which impulses initiated in sensory nerves by injury are relayed or conducted antidromically, that is, in opposite direction from the axon terminal down other branches of sensory nerve fibers on the arterioles. You can also see in the diagram. These branches carry nociceptor pain information and they release substance P and other mediators which causes vasodilation of arterioles. This flare is absent in locally anesthetized skin and in denervative skin after the sensory nerves have degenerated, but it is present immediately after the nerve block or section above the site of injury. Why this is so? Because the axon reflex is a local response and it is mediated due to the release of chemical mediators locally. Now come to the procedure. Choose the anterior aspect of the forearm in an area with less pigmentation and little hair. Clean the skin with alcohol swab and let it dry. Draw or strike a pointed or sharp edge object, a pointed pencil or a closed forceps firmly on the skin of the ventral surface of the forearm. The response varies with the degree of injury. If a stroke is moderate or light with moderate pressure, it will empty out the skin capillary having a white line in its way. The reaction differs from person to person. But the full-fledged response obtained with firm stroke, especially in the sensitive skin, consists of following three stages. So, number one is the red line. Strike the skin firmly with a pointed sharp object. There appears redness within 8 to 10 seconds. It is due to the vasodilation of capillaries. This reaction is followed in a few minutes by wheal reaction. In wheal reaction, there is edema And this is due to the accumulation of fluid at the site of injury due to the leakage of fluid. Why there is leakage of fluid? Due to increased capillary permeability. Last is the flare response. Flare response is the diffuse redness. In the surrounding redness around the injury is due to the chemical mediators which are released from the stimulating free nerve endings. Now come to the precautions. Do not use sharply pointed object to avoid bleeding. Number 2, strike firmly the object on the ventral surface of the forearm in order to observe all the 3 stages of response very clearly. And last is scratch the skin without oozing of the blood. These are the relevant questions. You can note down the answer in your notebooks.
Assalamu alaikum students. We are going to perform practical of triple skin response. Triple skin response is a simple procedure just to demonstrate the local inflammatory reaction. For this practical, we need a forceps, alcohol swab and a cotton. First, take the alcohol swab and clean the ventral surface of the forearm. Now dry it with a cotton. Now take the forceps and apply a gentle scratch. Now students, you can see after applying the scratch there appears a white line. This white line is due to the displacement of the blood from the capillaries. Within a few seconds, you can see there appears a red line. This red line is due to the vasodilation, which is caused by the release of local mediators, especially the histamine. Now as the time passes, within few seconds more, there appears the edema, which is known as the wheal. This edema is due to the increased permeability of the capillaries, which causes the leakage of fluid from the capillaries. Now in the last, there you can see there is a diffuse redness. This diffused redness is known as the flare reaction, and this flare reaction is mediated by the axon reflex. In axon reflex, there is a release of the substances, especially the P substance, and also the release of histamine from the mast cells. And this causes the vasodilation in the injured part, and there appears a diffuse redness. You can appreciate easily here.